Good afternoon, everyone. Today, I, Menahil Kamal, will be presenting our work on a blue light therapy device for wound healing. This work was done in collaboration with a team of undergraduate biomedical engineers and researchers from Rifa International University, Islamabad, and the Asia Pacific University in Kuala Lumpur. Our project explores an innovative approach to wound care, aiming to develop a portable, non invasive device that leverages the therapeutic benefits of blue light. The aim is to provide a solution that is both effective and affordable, particularly for patients suffering from chronic wounds. Now let's dive into the details of this research. Chronic wounds, including diabetic ulcers, cuts, and pressure sores, are a significant healthcare issue affecting millions globally. According to the World Health Organization, chronic wounds impact approximately 40 million people each year. Traditional wound therapies such as skin grafts and hyperbaric oxygen therapy have shown effectiveness but are often invasive, costly, and not widely accessible. This need for better solutions has sparked interest in alternative therapies like blue light, known for its antimicrobial properties and ability to promote cellular repair. In this project, we aim to address a gap in the current market, that is, the lack of a portable, cost effective, and non invasive blue light therapy device specifically designed for wound healing. Our goal was to create a solution that could provide controlled treatment, is easy to use, and can be employed in various healthcare settings, including clinics and home care environments. While conventional wound treatments are effective, they come with several limitations. For instance, skin grafts and negative pressure wound therapies are invasive and expensive, making them less accessible to patients who need them. Additionally, healing rates for chronic wounds remain slow, which not only increases healthcare costs but also leads to prolonged patient discomfort. In light of these challenges, we identified a gap in the availability of accessible, affordable, and effective wound care options that could provide the same benefits in a more user friendly and less invasive way. To fill this gap, our project focuses on developing a blue light therapy device for wound healing. This device is designed to be portable and capable of providing targeted therapy with built in safety features, making it a viable option for widespread use. Our primary objective in this study was to design and develop a portable, non invasive blue light therapy device for wound healing. We wanted the device to be customizable, allowing healthcare providers to adjust light intensity and duration based on the specific needs of each wound type. Our motivation stems from the demand for accessible wound care options that are both effective and easy to use. Blue light has demonstrated efficacy in previous studies by promoting cellular activities like collagen synthesis, fibroblast proliferation, and angiogenesis, which are crucial for tissue repair. We aimed to translate these scientific findings into a practical device that could make a meaningful difference for patients suffering from wounds, whether in a clinical setting or at home. Our device brings several innovations to wound care technology. First, it utilizes pulse width modulation or PWM, which allows precise control over light intensity and therapy duration. This adjustability is crucial for tailoring treatment to individual patient needs as wounds vary significantly in terms of depth and healing stage. Another key feature is real time temperature sensing. Overheating can damage tissues, so the device is designed to monitor and regulate temperature, ensuring safe and effective treatment. Finally, our device is compact and portable. This design allows it to be used not only in hospitals but also in home care, which is particularly beneficial for patients with limited access to medical facilities. By making wound care more accessible and versatile, we hope to provide a significant improvement over traditional treatments. Our approach started with the basic design of a device that could deliver blue light in a safe, controlled manner. At the core of our system is an STM32 microcontroller which manages the device's settings through pulse width modulation or PWM. This allows us to control the intensity of the blue light and the duration of each session. The device also incorporates temperature sensors and a cooling fan to prevent overheating, which is critical for patient safety. Users can adjust the therapy duration and intensity using simple control knobs, with treatment parameters displayed on an LCD screen for easy monitoring. We tested the device on a group of 20 volunteers over 6 weeks. Each participant received blue light therapy according to the specific requirements of their wound type, whether superficial, partial thickness, or full thickness. Data on wound healing progress was collected throughout the study, and any adverse reactions were carefully monitored and addressed. Our findings were promising and demonstrated the effectiveness of blue light therapy for wound healing. For superficial wounds, 85% of participants showed improved tissue granulation and wound size reduction. Partial thickness wounds also responded well, with 66% of participants showing significant epithelialization and depth reduction. For full thickness wounds, we saw improvement in about half of the cases, though progress was slower. This was expected as more severe wounds generally require longer healing times and sometimes additional treatment modalities. The graphical data shows clear trends with faster healing rates for less severe wounds, highlighting the potential of blue light therapy as a non invasive treatment option. Our analysis confirms that blue light therapy is a viable option for wound healing, particularly for superficial and partial thickness wounds. Full thickness wounds showed some improvement, but the response was slower, likely due to the complexity of these cases and the presence of any underlying health issues. Summing up, our blue light therapy device offers an effective, affordable, and user friendly alternative for wound care. For minor to moderate wounds, it provides a safe and accessible solution that can reduce reliance on more invasive and costly treatments. The device's portability and ease of use also make it a valuable option for home care, helping patients receive ongoing treatment without frequent hospital visits. This could have a significant impact on healthcare costs and patients' quality of life. While our study yielded promising results, it is important to note some limitations. First, the sample size was relatively small, with only 20 participants. This means that while the results are encouraging, they need to be validated in a larger study. Second, the study duration was only 6 weeks. For chronic wounds, longer follow up is essential to fully understand the device's long term efficacy. Finally, the device showed limited effectiveness on full thickness wounds. This suggests that while blue light therapy is beneficial for moderate wounds, additional treatments may be necessary for deeper wounds. Addressing these limitations will be an important part of future research. To build on our findings, we recommend several future steps. Expanding the study to a larger group of participants over a longer period would provide more comprehensive data on the device's efficacy. We also suggest exploring the addition of other light wavelengths, such as red or infrared, which have deeper penetration and may improve outcomes for full thickness wounds. Comparative studies with other wound healing technologies like negative pressure wound therapy and hyperbaric oxygen therapy would also be valuable for positioning blue light therapy within the broader landscape of wound care options. Lastly, refining the device design by adding more customizable treatment options could improve its adaptability to different wound types, further enhancing its clinical relevance. Thank you all for your attention. This concludes my presentation on our blue light therapy device for wound healing. I hope this work has provided insights into the potential of blue light therapy as a non invasive and effective alternative for wound care. I am happy to answer any questions or discuss any aspects of the study further.